Tracey Haas. I am a co-founder of DocBookMD, co-founded with my husband, Tim Garamy. DocBookMD was born on the night of our very first wedding anniversary. Tim and I were at a very nice restaurant, and like most nights on call, we had to take 2 cars to dinner. And unfortunately, right as appetizers came out, Tim got called into the trauma hospital. The doctor on the other end was not able to describe this fracture very well to Tim and said that it was emergent and he needed to come in right away. So much to my dismay, I was left alone at the table, which is not an unusual thing when you're married to an orthopedic surgeon. Unfortunately, hours later, when Tim came home, we found out that it was in fact not an emergency and he didn't have to go in. That was the night that DocBook was born, because we knew that this technology existed where we could get to see an x-ray on our brand new iPhone. We knew this technology was out there, and so we started that night researching how could we get an x-ray to show up on the phone so that he could decide whether or not it was truly an emergency or not. We basically worked backwards and now have come full circle and are able to do just that. An ER doctor can now take a picture of the x-ray very clearly, send it securely, HIPAA compliant, to our iPhone. Now at dinner, Tim can say, send it to me on Monday morning and I'll take care of it then. It has been a game changer for us professionally as well as privately at home. As a family physician who does a lot of urgent care, for example, I have to get a hold of multiple specialists, and I don't always know who's on call, but I know who I like to refer to. And now I have, in a very easy and very quickly accessible way, I've got their back line. Often I have their cell phone number. I can send them a text message securely through our messaging. I can look up their photo. I can verify with the patient sitting right there, is this your doctor? Is this who you want me to call? And I don't have to bother my front office staff. I don't have to take the nurse's time to go and look on a website or look up in a paper directory. They can actually, I can make the phone call right then and there. And often it helps. The patient can hear the appointment that I've just set up for them. I can give them options. Sometimes I even ask the front office whether or not they take my patient's insurance, and it saves a lot of time that way. Another feature that's been very helpful to me is the pharmacies. I can actually call the pharmacy through Bluetooth on my car on my drive home. It's not an unusual scenario for my nurse to call and say that a patient lost their prescription on the way in, or we accidentally faxed it to the wrong pharmacy. And my nurse will call and say, could you call this into a different pharmacy? And all she has to do is tell me the crossroads. I can quickly look it up through Bluetooth, safely call it in faster than I could write it back in my office. So that has also been a big time saver and improvement in patient care for me. As an urgent care physician, I'm faced with a kind of an interesting scenario on any given day, in that it's a patient that I don't know, and I'm often having to pass it off to another doctor who either may or may not know this patient. For example, if there's an infection on one day, I would like to see how it's progressed on to the next day. And what's helpful now with DocBook messaging is that I can actually take a photo, send it to that doctor, and they can tell me whether or not the redness has grown into a larger area, has the cellulitis gotten worse, or is it improving? And that is point of care medicine that is better than the pictures I can draw in the chart, and it's actually real-time information. So the first time I realized that DocBookMD was going to change the way that I practice medicine was a day that I had a patient come in to see me who had just recently had a urologic surgery. And she was actually having a complication of the surgery, and while under the influence of some pain medication, she could not remember the name of her doctor, nor could she find the number. Her family member drove her into her primary care doctor's office, which happened to be me that day, and she clearly had an issue that needed to be followed up by her surgeon, and the only information she could give me was, my urologist is blonde, and she told me the street that the doctor worked on. And so I was able to pull up with DocBookMD. I was able to say, okay, I went to urology. I was able to, with the thumbnail pictures, see that there was only one blonde urologist in our town on that particular street. Before I even had to look up the address, I just held up the picture. Is this your doctor? She said, yes, it is. I was able to call on the back line. I got the doctor on the phone within 30 seconds of the patient coming into the room and explaining the story. Sure enough, the urologist wanted to see her right away with this complication, and I got her immediately in. This kind of scenario would have taken half a day or more, and actually in most cases would have ended up sending the patient into the emergency room for them to call the urologist on call. Instead, my patient got better care, she got it done quickly, and I realized that it was really going to change everything from here on out. Now sometimes Tim and I can actually take one car to dinner, knowing that a lot of these emergencies actually aren't always emergencies, and we actually can verify that through our iPhone using DocBookMD.